Life is both simple and complex. Our past links us to our present and future. Some of us know our role and purpose. Most of us are trying to figure it out. Join me. Let's figure it out together.
Welcome back. My name is Fritz. I'm a New York State licensed psychologist, and this is the Ask Dr. Fritz Show. Each episode, we talk about various issues from the field of psychology as well as issues that are affecting us in our communities. During this episode, we're going to be doing a second part of a discussion we began in an earlier episode. We were talking about anxiety disorders, and we had a chance to, during that episode, go over a bunch of the anxiety disorders that are often diagnosed in mental health settings. Again, my name is Fritz. I'm a psychologist, and each week I work with people individually on these issues, and I like to bring that information to the conversation. If you want to find out more about me or what we do on this program, go to our website, askdrfritz.com. There you can find out more about me and see prior episodes, see the anxiety episode, the part 1 where we begin the topic. I think we could probably do a lot of different episodes on the topic of anxiety. We're actually going to do some more where we include a psychiatrist. But today we wanted to focus on what you can do about anxiety. And I know a lot of you out there feel it, experience it every day. We're going to go back and do a little bit overview right now. In the studio with me is one of my colleagues, a graduate student in psychology at Queens College. Welcome, Vlada Levitt.
Hello, thank you for having me again.
Thank you for coming back on again. And thank you for joining me in this forum. You know, we're sitting here in a TV studio, and it's a very relaxing thing we're doing here.
Yeah, the anxiety didn't stop me from going on again, so that's good.
Good. I didn't scare you off from the first time of doing this. And a little story about me as a child, I was a very shy and introverted child. I still think I'm quite introverted, but nonetheless, I've got to perform out here and bring this information to you. And I think one of the things I was telling you is that over the years of getting the opportunity to present to people, to get out there and to do this sort of thing, it's gotten a little bit easier. I've been able to overcome some of the anxiety that prevented me earlier on in life from jumping out there and trying to be a leader and be a part of, what we're doing right now. So it's very brave of you to come on with me. I know that you said you really love doing this sort of thing, do you not? She's laughing because that isn't necessarily the case. But let's pick up where we left off. During the first episode, when we talked about anxiety, we talked about generalized anxiety disorder, we talked about panic disorder, we talked about post-traumatic stress disorder, PTSD, we talked about OCD, we talked about specific phobias, and social anxiety. There are more disorders out there. If you want to find out what we talked about during that episode, again, go to the website, Ask Dr. Fritz. We're also on YouTube at youtube.com/AskDrFritz. Jumping ahead of myself. But we also touched upon treatment options, and I like to pick up our discussion right from there. Many of people who are experiencing anxiety will go to a primary care physician, or they'll talk to somebody about it. And one of the first things that I see happening with a lot of people is that they're getting prescribed medications. And again, like I said at the top of the program, we want to get into the different medications that are offered and the treatment options there. We're going to do that with a psychiatrist in a subsequent episode to this one. But today we're going to talk about what happens when you try to address anxiety from a more psychological perspective. But before we even get into that, let's talk about what anxiety is, what it feels like.
Well,
what's it feel like for you?
The physical symptoms right now, I guess, could be sweaty palms, increased heart rate,
Okay.
Sort of a pit in your stomach. But those are very common, and they differ with different disorders.
So one of the ways that we know we're anxious is by how we feel. And many people will feel that pit in the stomach, or they'll feel trembling hands, or they'll have, maybe their voice will flutter. What else happens? We can't speak.
Your mind is cloudy.
Your mind gets cloudy. You might start acting in very abrupt or jittery ways. I mean, there's so many different signs. Think about how you experience anxiety. Think about, what normally happens for you. It's the way that you will know that you're anxious. Any other symptoms or any other feelings that you can think of that right now?
I think we covered them all. I think the main one I'm thinking of is sweaty palms and weird stomach sensation and jittery, your heartbeat is excessive. But that level right now, I think it's a healthy level. You're in a certain perceived, somewhat threatening environment. My ego could be sort of nervous.
Not here, of course.
No, of course not.
Not
but
here.
it's a perception.
Yeah.
But
I mean, actually, the reason why we're talking a little bit about even here is because the perception of being on camera or being in front of a lot of people, for most people, is an anxiety-producing thing. It's actually the number one thing that people fear is getting up in front of a room or in front of others and presenting and speaking to large numbers of people. But what I told Vlada before we started is that we're really just going to be having a conversation between us, and you friendly people out there are going to join us, of course, because we're really speaking to a collective experience we all have. And for me, again, growing up, there was a lot of anxiety around public speaking. There was a lot of anxiety about doing something like this was just off the table until I realized through my work with people and my studies of psychology that one of the best ways to overcome the things that you're nervous about, is to set yourself up incrementally to get those things done, to really get over the ledge and actually do those things and practice those things.
To show yourself that they're actually not fearful or they're not scary.
Or if they are, get in there and do it, and then realize that, wow, I was able to get up there and do that thing and I survived it. Because a lot of our natural built-in anxieties get over-focused on certain tasks. I mean, anxiety is a good thing in and of itself. It's what helps us in nature stay away from things that we intuitively and naturally know is dangerous, predators, dangerous situations where we could fall and hurt ourselves, and all kinds of natural dangers out there. But as human beings living in civilized societies, our anxieties can be placed on simple things like just talking to a camera or talking to a room full of people. And the same things that were in us that were wired to react to a saber-toothed tiger is still built within us to react to other situations which are otherwise innocuous, like being here. This is so relaxing now, right?
Exactly.
And so what we're doing is we're gonna actually stay tuned, because during the end of this episode, we're gonna talk about also what you can do right now, sitting and watching this, to reduce the anxiety. But I still want to stay with a little bit of the treatment approaches to it. So let's jump into that. When somebody first comes to me, and let's say they're coming to me because of an anxiety issue or anxiety disorder, what we do initially is we do an assessment. It's often like a checklist where we ask them to just check off the kind of symptoms that they're experiencing. We give people a chance to tell us whether they do have the sweaty palms, the knot in the stomach, the trouble sleeping, the jitteriness, the trouble concentrating and focusing, any changes in their behavior, the brain fog. We give them a chance to tell us about what's going on with them. And then as we get to better understand what their symptoms are, we then look into what are the triggers of their anxieties. For some people, it's actually specific situations. It might be being in public or being around lots of people. It could be phobias of snakes or certain things like that, heights, or it could be something deeper. And as we get in through the assessment process, as we understand what the triggers are, treatment involves trying to help them kind of rework that and get around that. And so beyond that, a lot of the treatments that we offer are of a cognitive and behavioral form. In cognitive behavioral therapy, for example, we help a person work around what we call incongruent beliefs in terms of the things that they are worried about. We help them understand that they can rewrite and rethink the feared situation, such as, like, say, being in here. And what did I do before when we were talking about being here? We're not talking to lots of people, we're talking to one another. And you're doing a great job of making me feel really comfortable just having a conversation with Vlada.
Glad I could help.
I'm glad you're here to do that. And then beyond that, in a cognitive behavioral treatment, we get the person to perform behaviors that would have normally been very anxiety producing, and hopefully we start off with something simple like being on a TV show, and then we work to something that is more anxiety producing. I'm joking here because we really started with something pretty difficult, but Vlad is doing a really good job, and so I want to thank you again for that. And then, you know, beyond that, what else can you think of that we would do?
Well, exposure therapy. So this is what we were talking
exposure
about.
therapy.
Yeah, exactly. But in a different situation, we would do it more. So I've had a history of anxiety since I was younger, not diagnosed, but I could sense it, based by all of those symptoms that we spoke about.
Sure.
And I would it was a lot worse, but I would practice going in front of a crowd, a classroom, or in front of friends, and then in front of a bigger classroom. And then I guess eventually here, this is nothing compared to how I used to react to this sort of situation, but it was progressive.
So what you were experiencing before we even did this was mild anxiety compared to what you used to experience, but there's something very important in what you talked about it, which is that through many experiences and before this time, you prepared. And so you prepared incrementally. You see, if there's something, and I tell this to people who may have agoraphobia, fear of going out in public, that the more you stay in, the more that fear can grow. The more you avoid things that make you anxious, the more powerful those fears can become. And we, you know, our emotions, and to a certain extent, like muscles, if we don't exercise them and exercise against the things that restrict us, they kind of take over. And a lot of times, and especially because we're here on an island, Staten Island, the only way in and out is on a boat and over a bridge in a car. And so for many people's anxieties have increased to the point where they cannot leave this island. And so what I encourage people to do, if you're watching this and you're someone that's homebound and your anxiety has gotten to the point where you haven't left the home in a while, is any chance you get, try to increase the locus of distance that you travel from where your safest places are. The more you're able to do that, the more you might be able to reclaim some of the space that you had lost in the past from being anxious. So the idea is to try and get out more, even if it is come outside of the house, walk around the block, and try to get further and further away from the space that your anxieties have limited you to. If your anxieties are so much that you're not even able to do that, try to do it in your mind. And that gets into more of a mental state of therapy that we also try to get people involved with, which is imaginal meditation, but imaginal and getting people into the mindset of being able to think through the things that they are anxious about so that they can actually get further and further away from, you know, what keeps them inside.
And that's also doing something else where it's forcing your mind and your body to think of something positive. So you're taking away from thinking of those physical symptoms that you're experiencing and thinking of something in a better way, and it's taking away from that. And that's creating less anxiety.
And that's creating less anxiety. So if you want to find out more information, again, we covered some of this information during the first episode. It was more so of an overview of what the different areas of anxiety are about. Today we're talking more about, we're just talking about anxiety in general and what you can do. One of the things that I want to talk about now is what I just alluded to, which is what's going on in your mind and what we can do with that. What you say to yourself and what you think has a great power over what you're going to feel. What you say to yourself about a feared object, situation, or experience will actually affect how your body responds to it. So if I think of a very anxiety-producing situation in my mind right now, if I were to take my blood pressure or my pulse, what I would probably notice if I picked the right thing to think about, I would notice that my heart rate would go in what direction?
Up.
It would go up. Our heart rates generally increase when we're in feared or anxious situations, and they tend to go down when we're more in relaxed situations.
Even if we think about it.
Even
and
if
that
we
is
think
very
about it.
powerful.
Right.
To think that you could change your state just by your mind. So in the same way that your mind perceives a danger, it could also limit it just through own repetition and your own
Right. Think of your mind
meditation.
as creating that TV screen, that image. If you're at home and you're watching a movie, a horror film, for example, remember watching a TV screen is like watching basically this big light bulb with images. And those images and the way that you appraise those images, the way that you interpret those images will affect how you feel. If the movie is made very poorly and it's not very scary, your blood pressure, your heart rate's not going to go up. But if it's made very well and you go along with it and your mind follows it, then you'll feel like you're in there. And have you been in those situations where you're looking at the screen and you're saying, don't go into the house, don't go into the house, and then something happens and you jump and you have an emotional reaction just like you were almost there, except you're safe at home. And so what we're talking about is the ability to work on that image that's in your mind, to re-script it so that you can create the images in your mind that are more relaxing. Like, think about a relaxing imagery. She looks like she's thinking about a relaxing imagery right now as she does that. And as she thinks about a more relaxing imagery, her face starts to get calm. I hope you can see this on screen.
Well, that's making me nervous. So
yeah, okay.
Let me continue.
Yeah, but notice that she closed her eyes. You can close your eyes. I told you I was going to do some stuff here. Okay. And as you close your eyes, your breathing changes. And I can always notice this with people with lighter complexion. As you keep that positive imagery in your mind, your blood pressure and the blood going to your face kind of relaxes a little bit. And now take a deep breath and get it into the diaphragm. That's right. And as you keep that positive or safe imagery in your mind, you can try this at home if you're watching. Try to keep a positive and safe, relaxing imagery in your mind. I don't want to even tell you what that imagery should be because everyone can create their own script. For some people, it's the safety and security of a special place. For other people, it's an experience they've once had before. Oh yeah, oh, you just came out of it a little bit. Okay. It's hard to do on camera, but she's doing a great job.
I could go back into it. It's a lot more relaxing than being present.
That's right. It was a lot more relaxing than trying to remember or think of what you're going to say next. And so, and now you see the change. And if you're watching this on camera, you can also see the change. I think our blood pressure just went up. In an episode later, we would probably have all kinds of things connected to you, and we would be able to show you that what you're thinking and what you're feeling affects your blood pressure, it affects your muscle tension, it affects your brainwave activity, it affects so many different physical functions of the body. At the same time, it's also affecting emotionally what you feel. One of the things I always notice during one of these episodes, the longer the episode that goes on, I even feel it myself. I feel actually more relaxed as I settle into the topic with you and get a chance to really connect with you about what we're talking about. And what we're talking about today is a little bit of what you can do about anxiety, what you can do about those feelings that you're often having. And these things you don't necessarily need a professional around to deal with. You know, one of the things we focus on also is breathing. That's what I got you to focus on before. So now as you're watching, I want you to take a deep breath. There she is, she's doing it again. You're my guinea pig today. So
better that than saying anything.
And so we want to get the air again into the diaphragm. Why is breathing so important? I've talked about what the imagery in your mind is, but let's talk about why breathing is important. Well, breathing obviously is a thing that we are doing from the time we were born. Breathing gets the oxygen into our body. And if our breathing is shallow or our breathing is interrupted, we're getting less oxygen into our body. So now take that breath and get it right into your diaphragm. The diaphragm is the area just below the chest. It's also where the rib cage meets, right in here. If you've ever taken yoga or done any kind of exercise or even Tai Chi, a lot of those arts are based upon good diaphragmatic breathing. So get the air into the diaphragm.
I think it's important before we continue this exercise to explain just it's diaphragmatic breathing, but also it's belly breathing to kind of make it more. Because I know when I tried to do it, when I was researching and when I was learning about it, it was hard for me to initially do. I was like, okay, I guess I can't, but it took about 10 tries to notice that you have to just extend your stomach, and it's because we're taught to breathe from our chest. So if you
Who taught us that?
Society.
Actually, when you watch, and I'm glad you stopped us for that, because when you watch a baby breathe, babies actually have a good posture. They're sitting upright, and they're getting the air into the diaphragm or the belly. But something happens to us as we get older and older, as we start to slouch a bit, and the air starts to get more into our chest. And we also do something in terms of breathing is that we stop and start a lot. If we get anxious or worried or we see something, what we'll do is we'll actually stop breathing, and that causes our body to get less oxygen than it needs. So belly breathing, one of the ways that you can actually practice the belly breathing or the diaphragmatic breathing is to lie down, put a book, a light book, on your belly, and then try to get the book to rise and fall. Rise and fall. And then that's the direction, that's where we want to get the air into. This kind of breathing is not that different from normal breathing or healthy breathing. We're not asking you to breathe in way deeper than you would normally. We're just trying to get you to become conscious of getting the air into the body and then out. What happens with a lot of us as we're doing something, we might get anxious for a moment and then we stop, and our breathing is very much interrupted, and we're kind of like a car that's not getting a steady flow of gas. We kind of start to buck a little bit. And the idea with making sure that we have good, healthy belly breathing, good circular breathing, is to make sure that the whole body gets a good supply of that oxygen all of the time. With oxygen deprivation in the body, we have a greater than average chance of a panic attack eventually, but it also is part of a lot of the other physical symptoms we experience. We get a little brain fog, we get a little kind of dizzy at times. We have a harder time focusing and concentrating on what's going on. And so with getting people to breathe into the belly, I hope you're continuing to do this as you watch this. You are.
I'm trying.
She's trying to pay attention to me and do that. And I said before, all you have
Trying
to
to
do is
relax and to stay
Right.
conscious, it's also difficult.
That's why I said I wanted you anxious before we started, so that you'd be very good at it, and you're doing a great job. So getting air into the body and getting it to circulate in the body is a great home technique for managing, regular anxiety. I know people out there experiencing some significant anxiety that require higher forms of treatment and approaches. But when you get people to do this on a regular basis, when I've been able to get clients and patients to do just about 5.5 to 6, 7, 8 minutes a day of good belly breathing during a relaxed time. Don't just try to practice this during a panic attack, but try to actually do this during a time when it's quiet and it's safe. What happens is that you start to develop and redevelop that technique that the infant had, which is to have better posture and getting good belly breathing going in and out. Any thoughts or comments about that?
I just find that fascinating that we're taught to do the opposite of what's healthy. So even when you're talking about having, you have to show that you're proud and you have to walk like this with your, and that limits your ability to breathe through your diaphragm. So.
Yeah, I think the teaching is probably not as conscious as it is example, and the example that we see. Many of you, when I've talked about just getting your posture a little bit better, sitting upright and trying to get the air into your belly, you probably realize that a lot of us are kind of like doing this. And it doesn't help if we're wearing tight clothes, or we're wearing belts, or we've got a lot of extra weight that we're carrying, because now it's forcing us to have a more constricted breathing cycle. And so if we just get people to lay back a little bit, getting the air into the diaphragm, it's a much better way to at least manage the body and help the body deal with what's going on.
Yeah, I think a good time to practice this is before bed. Even I find myself doing it. That is your most relaxed time, or at least it's trying to be, and you have nothing else to do rather than try to fall asleep. And it's the best time to practice. So tonight, if anybody wants to.
That's right. It's a great time. And actually, one of the things that I also instruct people to do is, as they're going into, if they're preparing for sleep, the time that you lie down to go to sleep, give yourself 5-10 minutes to just kind of lay down in that position. And you can practice it with your hands on your belly, just getting the air into this area in a circular pattern. That's right. I'm a little congested, so if I start coughing, it's okay. But getting the air. And if, let's say you are congested, then you can breathe in and out through your mouth. That's no problem. Actually, that's what I'm going to do right now. This is the most relaxing episode. And you thought we're going to be talking about anxiety, which makes people nervous, but I really wanted to focus on, because people often think it's just going to be, we're just going to talk about medication, we're just going to talk about the disorder part. But what I've realized over the years in working with people, that when I said to them, or when another healthcare provider said to them, go home and relax and rest, that people often didn't know. And if we said, well, go home and do some relaxing breathing, they often didn't know. And if you remember from before, I said 5.5 to 6 minutes of breathing. What I found in working with clients is that if you just get them to sit down and do some belly breathing for about half a minute, it's not going to do that much. That you actually have to get them to do a lot more than that, because oxygen is the operative factor here. We need to get a lot of oxygen into the body, and a half a minute of good breathing is a low dosage. And if we're experiencing anxiety, or if we're prone to experiencing anxiety, we need a lot more oxygen. You have to remember, in a hospital, if you need oxygen, in order to get oxygen, someone has to write a prescription for it. In the hospital, oxygen is a controlled substance. You need a prescription for it. Well, in everyday life, it's free. And we can get it without having to get a prescription for it. So this has been fun. I didn't think we would spend so much time on the breathing, but I guess that's something that we should spend a lot of time on, because it's something that, even before you see a healthcare professional, it's something that you can do on your own. And the important thing is that you're not doing it in the middle of a panic attack. You're not waiting for that. You're trying to do it as often as possible. And again, what I said is, if I can get people to just take the 5.5 to 6 minute break every day, whether they're sitting at home in a comfy chair, sitting on a subway, sitting and having a conversation, guess what it does? It actually, one of the things it does is it helps you concentrate. It helps you be able to focus more on what you're doing. So as you're sitting there and breathing, see, I'm watching her blood pressure rise and fall, and I'll know whether it's rising and falling based upon how much she's getting the air into her, and she looks so much more relaxed now than before. So we have less than a minute to tie this thing up. We're going to do more episodes in less than a minute. It went so fast. We're going to do more episodes on the topic of anxiety. Like I've mentioned before, we're going to have a psychiatrist come onto the program and talk about medications. He and I may go and, he or she and I may go back and forth about our different approaches. I tend to have good rapport with the psychiatrist I work with, but so we'll have fun with that. And I want to thank you, Vlada, for coming on.
Thank you for having me.
And letting yourself be anxious and vulnerable, and at the same time showing everyone how just breathing and sitting and being present can also help you relax. My name is Dr. Fritz Gillette. If you want to get this program, share it with somebody, just go to the Ask Dr. Fritz website. Thank you for joining us.